Assalamu alaikum. Now we are starting with the chapter number 18, that is about pharmacology. As you all know that pharmacology is a branch of biology in which we are studying about the drug, the composition of the drug, its properties and its medical applications. So we can say that the word pharmacology is a combination of two Greek words, pharmakon, an active principle or equivalent to drug, or a medicine, or a poison, or a chemical, and logia meaning study. So, pharmacology means the science of drugs in simple words. Okay, pharmacology is not a new branch. Clinical pharmacology was present in the Middle Ages also. Pharmacology developed in the 19th century as a biomedical science. So, what is a drug? First, we will talk about the drug. Any substance that affects the process of a living organism is called a drug. Okay, drug can be broadly classified into two ways. Drug, a substance other than the food that can change the structure or function of a body or mind. For example, cocaine or heroin. That is also called the abusive drugs or the addictive drugs. Medicinal drugs, the other name for the medicinal drugs are the pharmaceutical drugs also. So a drug that is defined as a chemical substance used in the diagnosis, cure, treatment or prevention of a disease. So what is the major difference between you can say addictive drug or the medicinal drug? Addictive drug are the substances that cause a change in a person's physical or the psychological state, while medicines are the drugs that are used to cure, prevent or treat illnesses or discomfort. So simple is that addictive drugs are used in treating illnesses when taken as directed by a physician or according to the instructions. It means that up to a certain extent, certain dosage, the pharmacist or you can say the doctor can suggest the addictive drugs also. While the medicinal drugs include the vaccinations and the other kind of the medicines which can cure. So first, we can talk about the medicinal drugs and their sources. Medicinal drugs are commonly coming from the five major sources. First, they are being prepared artificially inside the laboratory, so we can say that these are the synthetic drugs. Second, these are coming from the major, you can say amount of the medicines are coming from the plants, and then drugs are even coming from the animals, and the other you can say other two major sources are the drugs are coming from the minerals and bacteria. Drugs are classified on the basis of their chemical properties and modes of action. On the basis of that, we are having different types of the drugs, such as analgesics. Analgesics are the painkillers which can reduce the pain. And in a simple word, we can give the example of the aspirin and the paracetamol. Second type is the antibiotics. Antibiotics can inhibit or kill bacteria and treat the bacterial infections, but there are the certain specific kind of the antibiotics to treat the certain specific kind of the bacteria. So tetracycline is the example of the one specific kind of the antibiotic. Then the third type come, that is called the sedatives. Sedatives can be used to slow down the functioning of the brain. It is mostly used to treat the depression or the anxiety. Sedatives can always be prescribed by the doctor first, and then we can able to use their sedatives. Other than sedatives, the fourth type are called the vaccines. Vaccines are used to develop immunity against viral and bacterial infections. For example, the vaccines including smallpox, whooping cough, hepatitis B, COVID-19 are broadly classified are broadly available in the markets. Okay, now we can talk about the biological contributions of the different scientists. Here we can talk about Sir Alexander Fleming. Sir Alexander Fleming was a Scottish biologist who discovered the antibiotic penicillin, and he even awarded with the Nobel Prize in 1945. There was an other scientist, we can say that the biologist Joseph Lister. Joseph Lister was an English surgeon, and he promoted the idea of the sterile surgery for the first time. Sterile surgery means the germs free surgery. He introduced carbolic acid to sterilize surgical instruments and to clean the wounds so that the patient will not get the further infections of the microbes in this way. Okay, before taking a medicine, one should be very particular for the certain things. Okay, medicines can help us to feel better, but if medicines are taken incorrectly, then they can actually make us feel worse. So it is very important to to just have a look of these certain points before taking any medicine. For example, always check the instructions on the doctor's prescription script, or make sure you can take the dosage of the medicine as prescribed by your doctor. Always check the expiry date printed on the medicine pack. Never take medicines prescribed for someone else, even if you think you have the same medical problem. Some medicines, such as antibiotic, must be taken for a specific number of days as prescribed by the doctor. Always check with your doctor before you stop taking a medicine or consider a new treatment. Some medicines are not suitable for children, and there are special children dosage for many medicines. Do not take medicine in the dark. If your prescription medicines are crucial for your health and life, carry medicines and dosage instructions with you whenever you are out of your home. Always keep healthcare products out of the reach of the children because it can harm them. And last, do not use the medicine if there are signs of tampering. Inform the pharmacist and the manufacturer of the medicine about it. So, one should be very particular about these all points before taking our medicines. Even it is, you can say, a special leaflet is available inside the medicine box. So before taking any medicine, we can just check that leaflet, and especially the expiry date of that medicine also. Now we will talk about the addictive drugs. Addictive drugs are those chemicals or the substances which can have the, you can say, addictive property, and the person become the person's body become dependent to that. So there are the major categories of the addictive drugs, such as sedatives, narcotics, hallucinogens. So if we talk about the sedatives are the you can say drugs that interact with the central nervous system to depress its activities. Sedatives include dizziness, lethargy, slow brain function, and depression. Long-term use of the sedatives introduce suicidal thoughts, and it can be, you can say, very it can be not good to take it for the longer period of the time. The second one type of the addictive drug is the narcotics. Narcotics are the strong painkillers. These drugs are often prescribed in conjunction to with other less potent and strong painkillers, like the paracetamol and the aspirin. So these are used to relieve pain uh, for patients with chronic diseases such as cancer. So we can say that these are also used to relieve acute pain after operations, and but some people may abuse narcotics for pleasure or the you can say having good feeling effect. Morphine and codeine are the two types of the drugs which can derive from from opium, a poppy plant, and it is having a direct impact on the central nervous system to relieve the pain. But the most but if the person will use it over the longer period of the time, the person become addictive to it, and it can even have the bad impact on the central nervous system and cause the drowsiness if someone will take it for the longer time. Okay, then the next one is the hallucinogens. Hallucinogens are the drugs that cause changes in the perception, thought, emotion, and consciousness. The group include mescaline, which comes from a cactus, and silicon, which comes from the mushroom. So we can, if we talk about the bad impact of the hallucinogens, so hallucinogens can have the impact on the sympathetic nervous system. It can cause the dilation of the pupil, and even it can cause the constriction of the arteries, and which can result the rise in the blood pressure. Okay, then the next type is the marijuana, hashish. Hashish is a hallucinogen which is smoked. It is obtained from the flower, stem, and leaves of a marijuana plant, cannabis. Small doses of the marijuana result in the feeling of well-being, but if the people will, or if the person will take it for the longer period of the time, or the higher doses, then it can cause many kind of the problems, including the production of the sperms also. Okay, now we can talk about the addiction and its associated problems. Drug abusers go through withdrawals of the social contact or the communication. They just become isolated, because they only depend upon the substance or the chemical to have that good feeling or the pleasurable feeling. So most narcotic addicts get involved in various type of the crimes, and get addictive in the robbery, shoplifting, etc. So it's my message to you people that don't let drug keep you from your dreams. Okay, Allah Hafiz, and spend a happy drug free life, because drugs are a death trap. So you don't need heroin to be a hero. You simply shouldn't be, you can say, dependent on this. So life does not rewind. Say no to drugs and live a happy, healthy, and good life. So this is all about the drug addiction and the associated problems. So Allah Hafiz students, and have a good day.